Many people blame every fever on typhoid, but how well do we actually know this illness? Hey, I'm Dr. G, and I'm here to give you tips on how to live a healthier life. So, typhoid fever is an illness that is caused by a bacteria known as Salmonella typhi. When this happens, you experience fever, flu-like symptoms, and some digestive problems also. This illness can be life-threatening, especially when not taken care of by appropriate antibiotics. Typhoid is commonly spread through contaminated food, contaminated water, asymptomatic carriers, that is, people who carry this illness and yet you don't know that they carry it because they have no symptoms. It can also be spread through poor hygiene. So, what are the symptoms someone experiences when they have typhoid fever? You can have fever. This fever can last for weeks, especially when it has not been treated. You can also have headache, chills, loss of appetite, abdominal pain, muscle aches, nausea or vomiting, diarrhea or constipation, to mention but a few. And these symptoms actually present like other diseases. So that is why it is very important that we get tested once we experience any of these and not just indulge in self-medication. A lot of people go to labs and they say, oh, I did whiteout test and then it showed I have typhoid fever. The truth is, whiteout test is highly unreliable, especially when it is one testing that has been done. It gives a lot of false results and then has increased the risk of antibiotics misuse and drug resistance to bacteria, because a lot of times we treat typhoid when we actually don't have it. What are the best ways to diagnose? Number one is a blood culture. It is most effective at the early weeks of the disease. And then you also have stool culture and urine culture, which are used to diagnose the diseases later. But the truth is, it is not just lab results that are interpreted. So lab results together with the symptoms a person experiences is what we use to make a full diagnosis of typhoid fever. So it's very important that you get tested in an appropriate laboratory or hospital. Emphasis on the appropriate. How is this typhoid prevented? Number one, ensure that you wash your hands before preparing meal or eating, after preparing meal or eating, after using the toilet or the bathroom. Number two, ensure you wash your food thoroughly, your fruits, vegetables before you consume. Ensure that you drink clean water. If you're not sure of the source of the water, make sure you boil the water or you filter it. Ensure good sanitation and proper hygiene. The best way to reduce the risk of typhoid is vaccination. So if you live in or if you're traveling to a place where this illness is common, it's very important to get vaccinated. Remember, not every fever is typhoid and not every positive test means you have typhoid fever. So ensure that you get yourself checked in a hospital or a good primary healthcare center. Don't forget to follow, like, and share. Bye.